In some Michigan nursing homes, COVID-19 spread like wildfire. Tonight, a special investigation revealing multiple facilities got big bonuses after being cited for not following safety protocols. Questions are still being asked tonight about COVID care in Michigan's nursing homes.
A new Local 4 investigation shows hundreds of nursing homes were cited for not following COVID protections, only to later receive thousands of dollars in money for good care. Grant Herm's looking into that story this evening.
My mom's gone. I can't get her back.
Carol Albin lost her mother and her uncle while both were living inside the Rivergate nursing home in Riverview, where COVID-19 spread quickly. Her mother passing last spring, her uncle over the summer.
I need some kind of justification for this.
Rivergate says neither died from the virus, although Carol's mother was running a fever so high she couldn't speak, while other residents also developed symptoms. Hospital records obtained by Local 4 for Carol's uncle show he was treated for symptoms suspected to be COVID-19, but he never tested positive. And then last September, the state sending this letter after an informal review.
Based on the observations, interview, and record review, the facility failed to properly maintain infection control practices during a COVID-19 infection control survey.
Rivergate was among the hardest hit by the virus in Metro Detroit during the peak of the first wave. Rivergate's parent company, Life Care Centers of America, telling Local 4 back in June, 55 residents died from COVID-19 in the nursing home and sister facilities next door. Several months later, Rivergate was given thousands of dollars in reward money for quality care.
You think they deserve this quality care money?
No, not at all. Not at all.
According to a review of federal and state records between March and August of 2020, Local 4 found 516 COVID-specific infection reports for the state's 435 facilities. These inspections were looking for everything from mask violations to failures that would put residents in immediate jeopardy. 173 were considered in compliance. 149 were given notices of failures. Of those, 123 gave plans to fix those failures, but 26 did not give the Centers for Medicaid and Medicare Services a plan to fix their problems. And maybe even more troubling, 194 were inspected, but the reports never say whether they were safe. And 6 facilities in the state were not inspected for COVID-19. So what about the money? Well, that money is from the Nursing Home Quality Incentive Program from HHS. The payments are based on a complicated equation based on resident cases over a certain period of time compared to county and community infections. Many of these facilities received money after submitting a plan to fix COVID protections. Others asked for what's called a desk review, in which an inspector evaluates a facility over the phone. But in many cases, a second inspection wasn't listed. In fact, according to the state, nursing homes are only inspected once roughly every 13 months. Despite that, many nursing homes raked in hundreds of thousands of dollars, including Rivergate, the facility getting more than $356,000. In all, Michigan nursing homes and long-term care facilities received more than $48.4 million, while their patients accounted for roughly a third of the state's COVID deaths. Rivergate was among those facilities that filed a plan to correct their COVID safety issues and maintained they were able to keep COVID cases low after their outbreak. Carol still wants answers.
Because I think that in my heart, I feel that they are hiding so much. I think they made a lot of mistakes, and I think there are a lot of families that suffered because of their mistakes.
Now, we did reach out to Rivergate several times, left several messages, but we did not get a comment back. We also should say that there are a lot of nursing homes that were able to navigate this pandemic well and receive that money. It's also impossible to talk about COVID and nursing homes without talking about the state's COVID patient acceptance policy. The experts that we've talked to from within the industry say there's just no evidence that that policy made things worse inside these facilities, or that moving those patients to somewhere else could have avoided deaths. Jason?
Boy, still so much we need to know. Grant, is there a way, by the way, for people to look up which nursing homes received money and how much?
Yeah, we've got links to all the documents that we reviewed for those inspections, as well as which nursing homes got money and how much they got, up right now on clickondetroit.com. Back to you.
All right, good information, Grant. Thanks.